So instead of taking a big cut, we make a small cut like a keyhole. Through that hole, we park a channel which has a camera attached. So we have a very nice visualization of the disease process. And through that small channel, which is not more than 8 millimeters, we are able to accomplish our process of freeing the nerve. So in essence, the amount of work that needs to be inside the spine is the same, irrespective of whether it is an open surgery or endoscopic. Hello everyone, I'm Dr. Akhil Tawari. I am a fellowship trained spine surgeon. We know that lumbar disc herniation, slip disc or sciatica is a very common problem. And why the good news is that majority, and by majority I mean 90 to 95% of these patients can be managed with conservative management in the form of medicines, rest and physiotherapy. A minority of patients unfortunately end up requiring surgery. A lot of patients who come to me as a second opinion for surgery are confused and they ask me, sir, whether you will do open surgery, whether you will do minimally invasive surgery or endoscopic spine surgery. And then based on that, they are either scared because the information is not complete. Let me discuss about what is endoscopic or minimally invasive spine surgery. Especially for lumbar disc herniation surgery to be successful, it essentially means that we have to clean out the nerve and remove everything that is compressing the nerve. So the main purpose of the surgery, irrespective of it being an open or a minimally invasive surgery, is decompression. For example, if we see this disc material, that reddish part has come out and is pressing on that nerve. If this patient is not getting better and is requiring a surgery, the purpose of the surgery would be to remove this bad disc material and to clean out this nerve so that the nerve becomes free and stops giving out the distressing signals in the form of sciatica. In order to handle this disc and to clear out this nerve, in initial good old days, it was done via open surgery. Although we were able to accomplish the objective of the surgery of decompression, the open surgery essentially meant that we had to make big cuts and remove a lot of bone. Now we are able to accomplish the same objectives of decompression through minimally invasive approach, and the latest advancement in that is an endoscopic or a keyhole spine surgery. So instead of taking a big cut, we make a small cut like a keyhole. Through that hole, we park a channel which has a camera attached. So we have a very nice visualization of the disease process. And through that small channel, which is not more than 8 millimeters, we are able to accomplish our process of freeing the nerve. So in essence, the amount of work that needs to be inside the spine is the same, irrespective of whether it is an open surgery or endoscopic. However, the process of doing that significantly changes in an endoscopic spine. Because we are using a small cut, we are able to have the patient get back to their life much faster. The chances of infection are much lower, the chances of bleeding is much lower, and the trauma to the muscles and bones is much lower. And that is the beauty and benefit of an endoscopic spine surgery. However, not all patients are candidates for endoscopic spine surgery. There are some patients who do need a tubular surgery or an open surgery, and therefore in order for the endoscopic surgery to be successful, we have to be careful in selecting the right patient. That is why we spend considerable time in examining the patients and also go through the MRI scan and take an informed decision on which patient will actually benefit from endoscopic spine surgery.